Hello and welcome back to yet another conversation with a specialist where we're going to try to blend modern day medicine with its holistic roots. Today, Dr. Chopra and me are going to be talking to Pranay, a very well renowned oral surgeon in the city of Mumbai. Welcome to our show.
Thank you.
Welcome, Dr. Pranay, to our small little session where we'll be not talking about, of course, you're a very well known oral surgeon in the town, and I've seen you work. You worked on me as well, so I can definitely say you're one of the better ones, I would say. And today, I don't want to talk about general oral health, general teeth and tonsils and mouth and stuff like that health. I want to talk to you about something that is a really big concern to everybody, and it's a lifestyle that has taken over the youth today and the grown-ups in such a way that it's very hard. We want somebody to tell us how to deal with it, how to stop it, how to control it, how to live with it. There are so many aspects of it, but we'll go over it one by one, and we'll really go into big details so that people who are listening to us will really be an eye opener for them. Thank you.
So, Pranay, while you're associated with Studio Aesthetic as our oral surgeon, I'd like you to tell our audience what are the other hospitals and centers that you visit. And I think you're basically dealing with oral cancer.
Yes, my major chunk of maxillofacial work is oral cancer, and I'm attached to a couple of hospitals like HCG group of hospitals, SL Radhika group of hospital, and Sanjeevani Mamata Hospital, BSCS, Criticare, all these hospitals where I'm attached, and I do my operative work, KLS, and plenty of nursing homes also, where we also cater to the group of patients who belong to the lower economic strata where they cannot afford at higher centers.
So, oral cancer has been declared as the second most highest rated cancer in India, also, besides it being, I think, number 3 in the world amongst cancers. So, can you throw some light on what it is that actually predisposes one towards oral cancer?
Actually, oral cancer, the primary risk factors include the use of tobacco and alcohol. Tobacco in any form, whether processed or unprocessed form, say for that matter, cigarettes, BD, gutka in Indian scenario, if you talk about, then the mishri that is used, to rub their teeth, and the mucosa, where people have very weird notions that if they do not use mishri, they would not be going to washroom, they won't get motion in the morning. So with all these things in India, India is one of the hub for oral cancer. And suddenly we are seeing this changing trend that initially the middle age was one of the most commonly affected. Nowadays, even the youngsters with the age group of 20 to 30 being reported with oral cancer. So you can imagine at what stage in their life they are getting exposed to tobacco.
Right.
Just like that. So, and easily now it's available, If you just walk around, you will see a lot of pan and BD shops where tobacco or tobacco related products are easily available to all the youngsters. So that's how the scenario is changing. More young people are getting affected with oral cancer, and I just wonder what the future would be like.
So, Dr. Pranay, can I ask you this is a layman question which people do ask, and at times I have also asked. So, there were a cream segment of people who used to smoke earlier. Of course, not mystery and all, but the real smokers and chewing of tobacco, which are pretty common. In fact, they used to carry tobacco pouch and keep chewing it, and they have lived a long and healthy, happy life. So, do you think it's this mass production of tobacco containing products is the reason for dissemination, or is it because of they are using contaminants in real tobacco that is predisposing to cancer, or who are we to point finger at? The producer, the consumer, the media, the advertisements? What is the real problem here? How do we tackle with it? Unless we catch the problem.
So yeah, as you rightly said, madam, nowadays there has been a rise in the oral cancer because there is consumption of more of processed form of tobacco which contains a lot of chemicals. So along with this, it is becoming it is more harmful to the body than what it may be before in a pure form. However, any form of tobacco consumption is harmful. And to blame, I feel the picture, the packet itself has a big picture showing.
People are desensitized. Seeing it every night doesn't bother them at all.
Yeah,
Those
so
scary faces.
if you see, I think in India there are a lot of laws, but the implementation is not there.
Correct.
Like there are laws like there shouldn't be sale of tobacco or any tobacco related products in 100 meters of schools or colleges. However, every institute outside you will find there is a shop of tobacco within 100 meters. So I feel the laws are there. There are a lot of tobacco related laws. There are a lot of tobacco, related laws which ban the production in certain states. Even our state of Maharashtra, the tobacco is banned, but it's freely available. Instead of 10 rupees, you would get it for 20 rupees, but it is available. So I feel there need to be some strong implementation from the government side, and some social groups should come up taking strict actions and getting in front of the authorities that these are the centers which are still working.
So, at the clinic, when we look into the oral cavity, I think the incidence of people chewing tobacco and then getting their buccal mucosa affected is most common that we see, and tongue cancers. These are the two cancers that we detect quite frequently compared to any other part of the mouth. So, the one which is limited to the buccal mucosa, is it for somebody who's storing that, the pan katha chuna in one corner and just leaving it there? How long do you think a person has to be habituated before they're affected with cancer? Does it happen to someone right away, or what is the staging, before they develop serious symptoms?
Yeah. So, how much time would they take from to get converted into cancer is very subjective and dependent from patient to patient. However, the body is great and it always gives some signs and symptoms. Like whenever a patient is or a person is keeping a tobacco at a particular spot in the oral cavity, that would turn and develop some sort of pigmentation would develop over there. They would develop some sort of keratosis, which will be like a flaky mucosa. So these are the signs that we should be really looking for in the oral cavity, like if there is some whitish patch or reddish patch or some sort of flaky mucosa or some sort of homogeneous growth or some sort of blackish pigmentation and there is severe gingival recession, then there should be some intervention, and that person should be sensitized towards stoppage the habit, and should be make aware of that, now is the time that you should stop, otherwise there are chances that in future you may develop oral cancer.
So erythroplakia, leukoplakia, all these precancerous lesions which a dentist can detect.
Absolutely.
But how does a normal person know that there's something not right in their mouth if they've not visited a dentist?
So I always say one thing, that anything that you see in our oral cavity, there are two colors which we see. One is pink, another is white. White is your teeth and pink is your mucosa and your tongue. So anything that you see different from these two colors in your oral cavity, there should be some warning signs for you. Say whether you see anything white, you see anything blackish, you see anything reddish, then there should be the sign that now is the time that we should go and get ourselves evaluated or checked from the dental surgeon or from the nearest specialist, whether this is really getting converted into oral cancer or oral malignancy, or is it whether it's a something what we call as a potential malignant lesion like leukoplakia or erythroplakia or lichen planus, one of these.
So tobacco being one of the dangerous substances, the other being pan, gutka, pan parak, of course chewing tobacco, all these things. But they are freely available. They are very tasty. People who like it want it and have it.
Yeah.
So should they take some kind of precautions so it doesn't turn into something cancerous and they enjoy what they like?
Actually, to be very honest, as a doctor, I would never recommend. I would never recommend any form of tobacco to be consumed, because tobacco is something like whichever area it comes in contact with can cause cancer in that area. Okay? Repeated using, of course. Occasional, of course, it would not. But repeated use is really, really harmful. Okay, and in India, actually, ma'am, there are so many areas where there's a culture where you visit the house, they would offer you, the erica nut or a processed erica nut. So there are certain things that we cannot really avoid, but what we can avoid is self-control, not get addicted to these things, and really, I don't feel there is a need and of us to fall prey to something which is not healthy.
So the bottom line you say is don't be a slave to bad habits.
Absolutely, absolutely. Don't be slave. Because I always tell my patient one thing, especially the patient who belong to lower socioeconomic strata, where I ask them like, how much do you spend on tobacco? So they tell me I spend in a day around 50 rupees. I give them a very simple calculation. How much do you spend in a month? They say 1500. Then I tell them in a year, they say 18,000. I ask them how many years you have been having it since. Then they say around 10 years. I said you have spent almost 2 lakh rupees, which they would have easily spent on the education of the children. So if you see the fact, or if you would have put it in a fixed deposit, it would have given them almost double the amount. So this is how now I started explaining to my patients that don't fall prey to this dirty or harmful thing.
Pranay, while it's tobacco that we are pointing at, are there any other predisposing factors? Because we all know that it's not just one thing; it's a combination of things that leads to cancer.
Absolutely.
So I know that someone who's chewing tobacco and having alcohol, it's like pouring, salt over a wound.
Yeah.
So you have alcohol, you've chewed tobacco, the surface is rough, and all the alcohol seeps in, and it's like putting in acid. So that's a patient whose chances of getting cancer just shoot up. A combination of alcohol and tobacco. But are there any other predisposition factors?
Absolutely. So alcohol along with tobacco has a synergistic effect in causing cancer. So that is one thing. Second is your oral hygiene. Believe me, it is one of the most, because if you see the literature also, 70 to 80% of the cancer is caused because of tobacco. But there is remaining 20% to 30% of cancer, which is caused because of poor oral hygiene, or maybe a sharp tooth, which has caused some amount of trauma and it is got, it's not healed, and constant trauma. Okay, so this is one. Now another aspect that has come in is human papilloma virus. Okay, so that is again one of the rising cause. Though in India not many cases are found because of human papilloma virus, but in Western world a lot of cases have been reported, especially the back of the throat cancers.
The human papilloma virus that's known to cause cervical cancer.
Same virus. P16 strain is one of the one which causes the oral cancer as well. So especially the base of the tongue cancer, the piriform, and all these cancers are caused because of the human papilloma virus strain.
Alright. Okay, great. So that's a lot of information on what are the causes of oral cancer. In our next session, we'll delve a bit more onto what are the first symptoms